Poor quality and standard in health and social care settings. So we have to recap. So we've mentioned watch the video as well, didn't I? We watched the video. We mentioned the care perspectives. We mentioned the patient perspective, the carer's perspective, and the stakeholders' perspective. So those are views that each stakeholder hold within the supply chain of healthcare. All right, let's look at this. So we're looking at the carer's views, stakeholder views, and then the other views that we need to take into consideration what we seek to do. We watched this video. Then we had to look at regulatory bodies, which could fall within the regulatory bodies, the roles they play and their responsibilities. That of government and policymakers, the role they play and their responsibilities, what they seek to achieve. They establish government policies, establish and oversee public health policy, where the regulatory bodies, organizations that's such as CQC, they protect and regulate, and not governmental, they offer specialized services in terms of their role. However, the responsibility is to raise awareness through advocacies, and then the payers are the insurance companies as well. What they seek to do is to ensure that their care services are cost effective. Then we have academic and research institutions. They conduct research. Their responsibility is to provide evidence-based recommendations and train next generation of healthcare. Community and family. Their role is to immediate support network for patients. Their responsibility, therefore, is to advocate for quality care and provide emotional and logistic support to patients and service users. Then we spoke about interconnected roles that involve people have to come together, regulators or research organizations have to come together to achieve a particular aim and objective. Stakeholder engagement and collaborative are fundamental in maintaining and improving quality in health and social care settings. Each group brings a unique perspective and role, contributing to the overall goal of providing safe and effective person-centered care. And we have to explore the role of external agencies in setting and maintaining standards. One of the key ones we have to look at the CQC. And the CQC, all they seek to do is to inspect and assess performance of healthcare and social care providers, including the GPs and hospitals. The function, therefore, is to conduct regular inspections, and I think I've explained to you before what the CQC does. So they are the only government organization that can approve a company or a healthcare provider before they can run their businesses. Without the CQC approval, you cannot. You cannot. So you need a registered manager, and then you need the CQC to give you approval. You could either meet up to be a good rating organization, an excellent rating organization, or you could be behind performance organization. The CQC have the right to close your care home or supported living facility should they have any concerns relative to your performance in terms of the clinical guidelines or in terms of safeguarding issues, or in terms of the policies that you need to have to meet up governmental frameworks, right? Then we have the accreditation bodies. The Joint Commission International is one of those. And what they seek to do is to evaluate healthcare organizations against a sort of global benchmarks. So they offer accreditation to healthcare organizations that meet up. And one of those examples that comes to mind is what we call the ISO, the International Standardization Organization. We have the ISO 9000, ISO 6000, and these are all a standardizing organization that companies need to employ or deploy in the organization. I remember when I was doing my master's, there was something called Six Sigma. Six Sigma. It is a lean operation that companies use or manufacturers use to sort of deal with lean operations in factories and all that. And those are things that you can employ in your service delivery. Then we have to look in professional organizations. We have the public health agencies, and we have the government departments, and then there are non-governmental organizations as well. You know, we have the Age UK Mind, role to focus on specific healthcare needs and issues. The functions will be to conduct research, raise awareness, and provide direct services to fill in the gaps in the healthcare system. You know, so that's what ATHE UK do, and this are not, but they do so well. They do a lot of research work, they do a lot of awareness and campaigns just to ensure that the healthcare industry would comply with and raise awareness for healthcare providers. The research and academic institutions, the Medical Research Council, they conduct research that informs healthcare policy and practice. Their functions, therefore, is to provide evidence-based research, offer training, education, and contribute to the development of guidance and standards. And we have to look into the interagency collaboration. And while this is collaborations, for example, you may have a research organization that would have funding to a particular anomaly within the healthcare. There may be serious safeguarding issues within the healthcare sector. However, this research organization could choose to collaborate with a regulatory body like the MSC or the CQC, so that the funding that they've had in place, it could be well strategized to implement those fundings. So this is what we call the collaboration, the inter-agency collaborations as well. So in conclusion, we've looked at CQC, we've looked at the MHRA, we've looked at the PHSC, the Public Health England, and then we've spoken about the National Institute of Care and Social Excellence. They all play a pivotal role in the shaping and upholding standards for various sectors. But let's digress a bit into the impact of poor quality standards in health and social care. Whereas poor quality standards in health and social care settings have far-reaching implications that affect not just patients, but service users, but also healthcare providers, the broader the healthcare system and society at large. The impact thereof can be categorized or can be grouped into various dimensions. One is to look at the clinical outcomes, you know, the increased mobility and mortality. Those are things that we have to look into. Complications, extended hospital stays, and even death. It's important we look at what are they? Could they be as a result of medical errors, inadequate protocols that can result in misdiagnosis, wrong medication, and inaccurate treatment and all that. And if you're a nurse or you're a carer and you cause such misdemeanor or medical errors, it could lead into your license being taken away from you. So these are key. Then we also look into financial consequences. You know, increased cost, poor quality care often results in readmissions and admission treatments. You know, then we have to look at the resource drain. Inefficient utilization of resources like manpower and medical equipment can lead to financial draining. The psychological effects, loss of trust. Patients may lose faith in healthcare providers, which can result in non-compliance. Emotional distress for patients and families receiving poor quality can cause a huge emotional and psychological distress. You know, what about ethical and legal implications? Healthcare providers may face lawsuits for malpractice, very key. The ethical dilemmas, poor standards raise questions about ethical responsibilities of healthcare providers and can tarnish the profession's image. Very key. And not just the profession, it also will tarnish the image of your organization for which you represent. Okay. Then we have the systematic effects. It could lead to reputational damage. Poor quality care can severely damage the reputation of your healthcare institutions, affecting their ability to attract patients, skilled staff, and funding. The policy changes will be consistent failures in maintaining quality can lead to more stringent regulations and making challenging our healthcare providers. The social impact will be inequality. Poor quality and standards often disproportionate affect vulnerable populations, exacerbating healthcare inequalities. Public health risks with substandard care can also have broader implications for public health, including the spread of infectious diseases. In conclusion, poor quality and substandard standards in healthcare have significant wide-ranging implications affecting patient outcomes, global health, stakeholder interest, and organizational reputation. Other factors can be patient disruption, global health burden, stakeholder implications, failure to meet standards, addressing and improving service quality and standard of crucial to ensure well-being of individuals and effectiveness of healthcare system. So let's move on and look at other ones. And we have to look into the quality of service provision in health and social care setting. It's a critical component that needs regular evaluation to ensure multiple optimal patient outcomes and system efficiency. Clinical audits, these are key. You need to have a regular clinical audits within the healthcare sector. And the advantage will be that it helps identify gaps and opportunities for improvement. The limitation will be it may be time consuming. Patient satisfaction surveys. Description. Questionnaires administered to patients to guide their satisfaction levels. The advantages, therefore, will be that provides direct feedback from service users. Limitation is subject to and may not accurately reflect the quality of clinical care. Performance indicators. Description. Quantifier measures like readmission rates, waiting times, and infection rates. The advantage will be that it creates objectiveness and easy track over time. The limitations will be that it may not cover all aspects of quality, such as patient experience. Then peer reviews, where peer reviews are your colleagues reviewing your own jobs or your own in research base, your colleagues could critique or review your own article or your research that you've done. So the advantage is therefore that it provides expert insight into clinical practice. But it could be biased because, hey, if your colleague has any personal reservations against you, they could be very biased in their critique. The accreditation and certification. Description would be that external evaluation by accrediting bodies often involve site visits and interviews. The advantages will be that it validates quality measures and can be a mark of excellence. Limitation can be costly and time intensive. Incident reporting. Advantage will be that it helps in identifying systemic issues and prevent future errors. Okay. Often underutilized due to fear of blame, because you have to report someone. Staffs may be very scared, maybe out of fear, and they wouldn't be able to report people who have caused certain safeguarding issues or incidents. And comparative studies, comparing performance metrics with other similar institutions or against national benchmarks. The advantage will be that it offers a relative measure of quality. The limitations will be that the difference in patient demographics and services offered can affect compatibility. Okay. The qualitative interviews. In-depth interviews with patients, families, and healthcare providers to explore experiences and perceptions. The advantages will be that provides rich contextual data. It is time consuming. So in conclusion, we've looked into the World Health Organization framework, the NHS England evaluation framework, and the care quality analysis. These methods collectively contribute to the comprehensive evaluation of health and social care quality, ensuring that services meet the highest standards and continuously improve to benefit patient service users. The references that you can resort to are Care Quality Commission 2020, the Parliament of Health and Social Care 2018, Dilemma the A25 Evaluating Quality of Medical Care, Billy Mark Quarterly, Institute of Medical Committee on Quality of Health in America, Crossing the Quality New Health System to 21st Century, Care Quality Commission 2020, Department of Health and Social Care 2018, Joint Commission International 2018, Public Health England 2020, Walsh K&R SM 2024, Berwick DM and Hackback AD 2018. These are some of the references you can look into. So you can read about books and journals in your student model. Any inquiries, you can email us to learner@UK Varsity. You have 2 weeks from now to present your assignments. All right. Okay. So I'll expect you to email any concerns that you have in your delivery of assignments. Do not hesitate to email me or the department relative to any concerns, and I'm gladly happy to review it and give you my opinion about your assignment. I wish you the best of weekend and have a blessed day. Take care. Right.